Imagine you could step inside the minds of Canada's healthcare leaders, glimpse their greatest fears, strongest drivers, and what makes them tick. Welcome to Healthcare Changemakers, a podcast where we talk to those leaders about the joys and challenges of driving change in our complex and demanding healthcare organizations.
Hi there, I'm Ellen Gardner.
And I'm Philip Souza.
And today on Healthcare Changemakers, we sit down with Kathy MacNeil, President and CEO of Island Health in British Columbia.
Island Health is a large and diverse region. On our episode today, Kathy shares how she focuses on a culture of accountability and building strong relationships in the community.
When asked about her thoughts on HIROC's new strategic plan, which is all about turning the corner on patient safety, Kathy talked about how together we can make an impact.
Be sure to stick around till the end for the lightning round to find out who would play Kathy in the movie of her life. We had so much fun chatting with Kathy today. We hope you love it. Leave us a review on Apple Podcasts.
This year, our vision, we're focusing on accountability and accountability for resources, accountability for standards, and accountability for quality and accountability for engagement. So we've just rolled out as of last week our strategic framework that we've been working on for the last year that has 4 goals in it. And we use big words in it like promise and commit. And so it's about our accountability to deliver on those goals.
Have you been talking the vision up with staff quite a bit?
Well, we are huge, as you know, a huge organization. So we started the implementation or the rollout back in the fall with formal leaders and our physician leaders. So we just last week was kind of the what I would say the release or the reveal to the whole organization. We're now 30,000 employees, physicians, and volunteers. My chin dropped when that number was given to me last week. But we continue to grow. We recently assumed responsibility for home care services in the southern Vancouver Island area that had been an outsourced service. So now all of those employees have become Island Health employees, or almost 1,000. So we continue to grow. And so as you can imagine, having that conversation in a way that's relevant for 30,000 people, it's really hard from a communications planning perspective to get tools and messages that will resonate with everyone. So we felt that we needed to do kind of a staged approach and engage our leaders. So again, in the theme of accountability, there's a strong accountability for our local leaders to translate those 4 goals and the strategies around those 4 goals into language that resonates and that's relevant for their teams.
It must be very challenging for you as a leader to pull everyone, the organization, and as you say, 30,000 people in the same direction. How do you do that, Kathy?
We have a small executive team, or relatively small. We have to rely on local leaders. And in order to ensure that we are all pulling in the same direction, we have to make sure that we're all aligned. And so using opportunities like we have what's called Leader Forum that happens on a quarterly basis where myself and my team travel up and down and across the island to be face-to-face and have some presence with local leaders so that they can hear from us our why. And not only do they hear from us, we hear from them. So I think that's all part of what allows people to work together as a team, is knowing that it's not just a top-down approach, that the directions that we take are very much informed by what people who are treating people feel and see and experience every day.
What are some of the things that you actually hear from employees when they're talking to you? Are they honest about their concerns, or are things going well? What is the tone of some of the things you hear?
I think we are probably very much like many healthcare systems across this country, where I'm describing the experience as swimming in the gray tsunami. So many of us have talked about the demands that are coming at us with I would say the boomer age cohort moving into more seniors cohort, and the impact that's going to have on healthcare delivery. And I think we're there here on Vancouver Island. We are there. We're seeing that age cohort of 70 plus growing at a faster rate than our younger age cohorts. And so that has its own demands on the services that we provide. And I hear those stories when I am in every community. So the way we used to deliver healthcare doesn't fit what we're dealing with today. And so it's the challenges that people are experiencing, I think, of modifying process and procedure and, quite frankly, our mindsets in real time. It'd be different if we could take a time out of time and kind of take a year out and say, okay, we're going to redesign all of this stuff and then go back into a system and do it. We don't have that because we have patients to see every day. And so I hear from clinicians and local leaders a lot about those challenges, about trying to meet the demands and make changes at the same time. And that kind of feedback has been very helpful when we talk about our enterprise risk management framework, and when we look at where we need to invest to get value out of the system. Things like investing in change management as a methodology to support leaders kind of came through that. What I would say that two-way communication, and taking us as an executive taking the next step to say, okay, how does that integrate into things like assessing risk?
It's been 2 years, Kathy, since you were officially appointed president and CEO. What were your top priorities when you stepped into the role?
I knew this organization. I've worked here for 5 years. So I had a sense of who we were and how we rolled. That's my language, how we roll. And so I think for me, my priorities coming into this position on a permanent basis, number one was to select. First of all, I did some structural tweaking. So I restructured a bit at the executive level. And then when I did that, I did some executive recruiting. So to get the best team that I could. And I'm really pleased with the team that we have. And then I embarked upon, we kind of got the wheels in motion around a strategic planning process. This organization actually didn't have a strategic plan. So and we've been working along very diligently on in alignment with the Ministry of Health's plans here in British Columbia. And that's all well and good. But from my perspective, there was no opportunity for clinicians and for the experience of patients to inform what that plan needed to look like. So we did that work over that year or so, and have come up with a plan that we can use. That's an Island Health plan that's still very much aligned with the Ministry of Health. The other thing that I focused on really was around relationships, and just my style of leadership. I'm very relational in how I work, and I really believe that the impact we have is at the individual level. And so, and you know, each person has the ability to impact a whole system based on how they interact in a system. So really working at relationships with our union partners, relationships with our physicians, relationships with the ministry, relationships with my other colleagues across the health system here in British Columbia, and relationships with our Indigenous communities here on Vancouver Island. So really focused a lot of time on developing those relationships and nurturing them over time so that we can have the trust we need to do the change work that's needed. And so that was a priority for me. And the other priority, as I was coming into the role, we were preparing for our accreditation survey, and just connecting that, not as an event or a moment in time, but using that as a lever to embed more strongly as part of our DNA, our commitment to quality and safety.
Hey, Kathy, it's Philip here. I have since you said I could ask you follow-up questions, I have a follow-up question for you.
Sure. Yeah.
I really liked how you talked about, how you came up with those priorities and you, worked with them with your team and you kind of embedded into the culture. I guess I'm curious, and I'm sure many of the emerging leaders who listen to our podcast is where did you tap in? Like, what did you tap into to, come up with that? Did you, did you have a kind of a coach? Did you talk to other leaders? Did you did it just come to you? Did you read something?
All of the above. So I've had coaches in and out at different times of my career, and as I transitioned into the CEO role permanently, I did have a coach for that transition. I believe personally, I've always benefited when I have career transitions. I've benefited from coaching during that time. So that was really helpful for me to kind of get clear on what mattered to me. I think talking to mentors and others in the system, I'm so fortunate. One of my mentors and colleagues is you're familiar with in your work, but I have mentors across the country. And so I feel so blessed to be able to reach out and get perspectives. And so that is helpful. One of the things for me in terms of my leadership challenge in this role was really to land on decisions and get clarity with the information I had at the time. So we can always get more information and there's always new information coming in, but at some point somebody's looking to someone to get clear on a decision to get going. And so I'm the kind of person who loves consultation. I love to hear different perspectives and I like to get more. And really, as a CEO, I had to get more comfortable with heard enough, have to go. And that's kind of, I would say, was my learning in that first, I would say that first 6 months. I also have to say, part of, to all emerging leaders and to all leaders, I would say one of my lessons learned is you have wisdom. You have wisdom that is inside you based on the experiences you've had and the learnings that you've had. So if you're truly learning, something's changing after an experience. And so that wisdom helps to provide you with clarity when you're in those times of transition. Trust that. And I think in some of kind of those setting priorities, and especially as it relates to the relationships piece, I really listened to my own intuition. And because I know at the end of the day, healthcare is a human activity. It's about healing. It's about human to human interaction. And so you can't do that without relationships. And it's going beyond the transaction of the work to meaning. And I think that's really, I think something that is inside of me based on the wisdom that I've accrued over the years that I've been at this work.
That's a great insight just about, yes, trusting your wisdom and the fact that you've built it up over the years with your experiences. Well, our CEO, Catherine Galton, who you know well, and I know you've worked together, she's told us that what she really admires is how you lead through asking lots of questions. So how does this approach help you in decision-making and making a plan for going forward?
So I think I was born curious. I'll just say that. And my siblings and my parents would probably say nosy, but I'm going to say curious. And that's been really helpful for me to be a lifelong learner because I'm constantly inquiring more. I read a lot. I'm always looking to see what other people are doing. But I think what Catherine's pointing to is I really value different people's perspectives. I know I have one, but it's just my lens. And it's my lens based on my lived experience. And as I learn more and more about cultural safety and humility, I realize that my lens is very much a white settler colonial lens. And so I need to make sure that I'm checking that perspective against others. And so that's why curiosity is so helpful in terms of being in, inquiring. The other thing I think I value about being curious is sometimes you can expose people's thinking just through asking questions so they can hear their own thinking out loud. And I have seen insights happen when you probe a little deeper and you ask people kind of, well, tell me more about that, or why do you think that might be that way? They actually hear themselves and they start to challenge their own perspective. So I think it can be a tool as well if you're coming up against resistance, or if there's a polarity that you see in terms of a perspective. Sometimes just continuing to lean into the questions helps expose what's actually underneath that thought or opinion.
So if you hadn't gone into healthcare, you might have become a journalist.
Or a detective. That's what I'm thinking. Yeah.
I want to take you back a little bit and just ask you about a job that you've had in your life that taught you the most.
I have to say, it's funny today that you're asking me this question. So my very first job, my very first manager passed away yesterday, and he was 91. And I've been thinking about him today. And I worked for him in a grocery store. And I learned a lot about people in that whole customer service role, just how people are so different. We are all so very unique. And so you can't stereotype or think that you've already seen or kind of predict the behavior, because everybody is so different. So I learned a lot in that very first job I learned about work ethic, and I learned about being part of a larger team. And when you didn't do your part, the impact that had on others. So I'm really grateful for that experience, and I'm really sad to hear that he's no longer with us. The other thing I think in terms of positions or jobs that taught me a lot, as I said, I was a physio, and I worked clinically for about 10 years, and then I worked in a more administrative role, and then I got asked to do change work. And I think probably because I was so curious, that's why I got asked to do this work. And I found myself doing change work in areas that I had no content expertise. And I think one of the things I learned from that is you don't need to be necessarily a technical expert to be a leader. You need to know how to hold respect for those who do have that technical expertise, but it's really about aligning to results and getting clear on what matters for people.
In our last podcast, we talked to Zaina Kayat, and her focus is on, helping healthcare organizations learn to think and act in innovative ways, mainly because a lot of healthcare organizations, they are committed to that, and yet they're still stuck in the old analog way of doing things. As a leader, you've said that you are committed to courageous innovation. So I want to ask you, what exactly do you mean by that?
First of all, I want to say I am a big fan of Zaina Kayat, so good for you guys for interviewing her. I think our country needs her courage, her inspiration, and quite frankly, she needs to continue to challenge us. Courageous innovation for me, when I came into this role, Island Health had been through a very bumpy implementation of electronic health record, in particular the computerized physician order entry component of an EHR. And we lost, I think, some of our spunk, for lack of a better word. because of the challenges in the technology, the challenges in the adoption of technology, the concerns around the change and the impact to quality and safety that the clinicians were experiencing. So for me, courage is about not being afraid to fail, but being able to pick back up again. So what we've done subsequent to that implementation is we've not pushed on CPOE, but we've implemented other aspects of the EHR in the community, in particular, where we know it's not going to impact practice, in particular physician practice, quite so much. And seeing benefits now of having an electronic health record for community clients available when they come to an emergency department electronically. So now emergency physicians can see what's been happening in home care and home support. That's tremendously helpful to being able to make good care, and also avoiding admissions if you know what the home support services are available to them. So there's another application of the electronic health record. It wasn't necessarily how we went down the road of implementing EHR around CPOE and medication, minimizing medication error, but it's actually another benefit that we can use. So courageous innovation is not being afraid to fail, or being ready to fail and being ready to stand back up again, and reframing what the benefits might be from a change. And I think the other thing I notice about our culture in healthcare is we do talk a lot about risk. We talk a lot about the risk of this, and our organization still does this too. Any change initiative or any new program or initiative we take on, we do a very robust risk assessment and the what ifs and how are we going to mitigate. But what we don't talk about are the risks of staying the same. And we don't do a risk assessment of that necessarily. And so if you only have the foibles and fear of the could be, instead of the foibles and fear of the what is, it's pretty easy to stay where you are. So I think that's the other thing about courageous innovation, is to be transparent and to talk about the risks of staying the same. And so we do. I try and have that balanced conversation when we talk about change, because without the balance, the change part looks really scary. And it looks like it's fraught with big minefields. But there are lots of minefields around the current state, and we need to have that very balanced conversation.
We know that a large part of Island Health's work it's happening in the community, and you work closely with Indigenous people and your partners. And you're really focused on improving health and wellness for those populations. How are you and your teams strengthening those ties?
That's a great question. And, we're all called to truth and reconciliation with Indigenous peoples across our country. And when I came to British Columbia, I became very aware. I would say probably because part of the impact of residential schools was still so acute here in the population. And we had a very large Indian hospital on Vancouver Island. The experiences of Indigenous peoples going to that hospital were tragic. And so those stories live on in these communities. So we have a lot as a health system. We have a long ways to go to reestablish trust, where hospitals are safe places to go. We're very lucky in British Columbia to have a health authority. It's a standalone health authority, First Nations Health Authority. It was established, I think, about 7 years ago, and through partnership with the province, the federal government, and the local First Nations, the Assembly of Chiefs, where the Health Canada funding for on reserve, as they say, or at home care, healthcare was allocated to the First Nations Health Authority. So we work in partnership with, we call FNHA, So relationships there are really important, and we basically co-lead. So we come together in any work that we do around Aboriginal health. We also have relationships locally. So with local First Nations, through chiefs and council, our board chair and myself, as part of our engagement work, we meet with chiefs and council. We go to First Nations communities. I participate in the regional caucus with chiefs. So they know who I am. They know who our board chair. They can put faces to names, and so can we. And so we can actually have relationships that we can talk through things. So when a member of their nation has an experience that's not what we want with our health system, that doesn't sit and kind of fester, and that we can talk that through, and we can do our quality reviews, and we can get underneath what some of those issues may be. We have three cultural families on the island: Coast Salish, Kwakwaka'wakw, and New Chalmers families. They each have their own ceremonies, customs, traditions. And if you're working in a hospital in one of those family territories, it's important to know what those traditions and customs are. What are the death ceremonies? What are the birth ceremonies? So that we can respect that culture as part of the healthcare experience. Through First Nations Health Authority, we have made a commitment that all formal leaders will undertake our cultural safety and humility training program, which is a 3-part training program. We're hiring an executive lead who is Indigenous and who can work with the three families around Aboriginal health, so that it's not, again, a settler's approach, but it is self-determined First Nations speaking for their health and care needs. So I'm very proud of this work. I think that we have a lot to be proud of here on Vancouver Island. We're lucky that we're an island. It makes it, we can wrap our arms around that. And I think just, again, declaring commitment in a very public way has been very powerful to rally an organization behind an initiative.
Were Aboriginal issues something that you've known about your whole life?
Well, that's a great question. I am a transplant here. I have been here on Vancouver Island for 5 years. I am actually a maritimer through and through. I call myself a 5th generation settler. So my family came to Nova Scotia 5 generations ago from Scotland. And so this whole, I have to say, my as an adult, I've been wondering since I've come here, how come I didn't know this before? And I know I'm not alone in asking, as a Canadian, asking myself that question. But I know also colonization happened from east to west. So in Eastern Canada, the Mi'kmaq people were the first to be colonized. And so the loss of language, customs, traditions, as I grew up as a maritimer, I was not exposed to any of that. And so, not surprising, I didn't know about it. At the time, there was never an Indigenous student in a class that I took in elementary, junior high, or one that self-identified or that we knew. So there was no exposure to this history of Canada that I had. I think, fast forward to today, I think, especially as we as healthcare leaders become more and more attuned to this, and certainly our Canadian College of Health leaders have taken a leadership role in bringing cultural safety and humility and Indigenous health issues to the forefront. We're learning more about our history as a country, and how that's impacted our healthcare, all of our institutions, our educational institutions, our justice institutions, and our healthcare institutions. And the work to get it right going forward is not the work of Indigenous people. It's the work of all of Canada. It is all of our work to do. So, for me personally, that's been a bit of a shift, because when I came here, we had an Aboriginal Health team, and every time there was a question, we just went to the Aboriginal Health team. So that was all good. We had a team. And it wasn't until we started to become awake to the fact that there's no way one small team and 30,000 people is going to indigenize the island health care system. It's going to take all of us to become aware of what are the underlying factors of our history that have gone into bringing us where we are. And then how do we need to change that at the systematic level, which is my role as a senior leader, and at the local level, at the care delivery level. That's the work of clinicians as they interact with patients and clients and community members every day. So it's going to take all of us to do our part, and it's going to take time. It's going to take time for all of us to learn the history, become aware of it, and then do the kind of go on the journey. As one of our board members has said so eloquently, the longest journey is from the head to the heart. So part of it is the learning part, the head, and then part of it is the change part, which is the heart. And we all need to go on that journey in our own way.
In 2019, Island Health, along with the BC Emergency Health Services, Solid Outreach, and the Lookout Housing and Health Society, you received the Gold Apple Award for Collaborative Solutions. Can you talk a little bit about that project and what the recognition has meant for you and your staff?
Unfortunately, we're not alone, but we were kind of the first to be struck by this wave of what we call the opioid epidemic in British Columbia. And these deaths that people in our population that it was an epidemic. So we were losing this age cohort out of our population due to unintentional opioid overdose. Our chief medical health officer here in BC called a public health emergency. And so we all pulled together to say, okay, what needs to change? And really use kind of an emergency response approach. So what started to crop up were things called overdose prevention sites, and they cropped up in many places. We had I think 8 here in Vancouver Island, 2 here on the South Island, where people who use substances could actually go into these facilities and use and be observed. And if they did overdose, either volunteers or paramedics that manned these overdose prevention sites could intervene with naloxone. But we knew that wasn't going to be enough. So we evolved to this supervised consumption concept where supervised consumption, yes, people can come and be supervised, can have some assistance, more hands-on assistance, but also we can wrap around services. And so we all know that how important the social determinants of health are in terms of the health and well-being of our populations. And, when you have vulnerable people who live on the margin or on the fringe, poverty plays such a role, mental illness plays such a role, access to food, housing, those are such key contributors to the overall health and well-being. And so we created in the supervised consumption site, which is called the Harbor, this wraparound program through partnership. And so the Gold Apple Award, the collaboration in this award was really about the partnerships that were created with the emergency health services, so the paramedics, with people who use substances. And the group here in Victoria is called Solid. So they're peers who use. And then Lookout Housing and Health Society, they are a nonprofit who are set up to work with those who are marginally housed, who are at housing risk. And so together, members of these 4 of us all kind of coexist within the supervised consumption space. The award was really about the partnerships, about coming together, seeing a need in a population, not necessarily getting too hung up on where we begin and they end, or where they begin and we end, but actually coming together around the needs of the population. And so what I'm proud of, first of all, is it's true partnership. And so not letting the bureaucracy of the organizational rules get in the way, and really putting our patients or clients at the center of what's needed to be designed. So it's truly client-centered design of a program.
Like most healthcare leaders, Kathy, you probably work a lot. I'm sure you're a person who's in the office pretty early in the morning and works late. So I wanted to ask you about your life outside of work, because we wonder, what do you do? What gives you enjoyment in your life outside the office?
Vancouver Island is a beautiful place to live, and I live right on the ocean. So my husband and I have a routine where we walk basically the ocean front on whenever we can, on weekends for sure. And then we go for our walks in the evening. I really appreciate that kind of decompression time. I'm a real water person, so I love the ocean, and I can't imagine not living somewhere that's close to water. So coming from Nova Scotia here, we also have a summer place in Prince Edward Island. So, again, right on the water. So I love being close to the water. It just is a very grounding place for me. I think the other thing that's important for me, or that keeps me grounded and that I enjoy, is I love music. I love to sing. I play guitar. I probably don't do enough of that now, but I still love to do it, and have fun doing that when I have the chance. And I love family. And so because we have family coast to coast, on weekends, I love to FaceTime and stay connected with my family. And my oldest daughter's still in Halifax. My parents are there. I have siblings in Ontario, and I have a daughter here in Washington State and one here in Victoria. So there's lots of people to reach out to and stay connected with.
Before Ellen gets to the lightning round, I had one other question for you as well. HIROC just launched its new strategic plan, and one of the priorities is turning the corner on patient safety. So if you could just think of one thing, what one thing would you think that would be that we as a healthcare community need to do to turn the corner on patient safety?
I'll tell you, Phil, the first thing that comes to my mind is I somehow, and I don't know how, but I think the thing we need is we need patients to have the tools to either self-advocate or have an advocate for safety. I think when patients know how they can advocate for themselves for patient safety, I think we'll be that will change our system. Again, going back to my theme of accountability, I truly believe, and I know we've tried this in many different ways and times around hand washing, but man, it is so much more powerful when the patient asks, just before we start, did you have a chance to wash your hands before you came in? Like, that changes and is such a powerful reminder. And only one patient has to ask a clinician, and that stays with the clinician. So what are the other ways that patients can do that? I think that's a really helpful tool. And I often think about these change things from the micro to the macro, right? So that would be a micro, one thing. Yeah. And at a systemic level, how do we turn the corner on patient safety? 100% from my perspective, it's about transparency. Mm-hmm. So we need to talk about it more. And so that means making it safe to talk about when it hasn't been safe. So when we have failed in terms of patient safety at either a trend or an aggregate level. And when I use the term patient safety, I'm also capturing in that envelope standards like choosing wisely, because quite frankly, too much care is unsafe care. So all of that goes into that bundle as well around transparency.
So it's time, Kathy, for the Changemakers Lightning Round. Wow. So we're just going to ask you 6 quick questions, and just tell us the first thing that pops into your mind. What is the best piece of advice that you've received?
Be yourself.
What's on your nightstand? What are you reading?
Right now I'm reading Collective Wisdom from High Performing Women from the Judy Project out of U of T.
What music or podcasts are on your playlist?
Right now on my playlist is Jim Cuddy, because he was here 2 weeks ago. I went to see his show, so pulling the old Blue Rodeo and his new stuff. But I'll tell you, my playlist has everything from Lizzo to Andrea Bocelli, so don't be surprised.
In the movie of your life, who would play you?
This is a hard one. I think probably Meryl Streep, and the reason I would say her is she can be warm, and she can be kind, and she can also be hard and clear. So that's why I pick her.
What's your favorite thing to do on the weekend?
I love to go out for dinner.
And if you had one superpower, what would it be?
I think it's probably reading minds. I think we get so confused in communication that it'd really be nice to read minds.
We really get the sense, Kathy, that you love being a leader, that you embrace the challenges of it. And for you, it's a learning process, but it's also a jump in and ask the tough questions and just deal with the challenges as they arise. What is it that you do love about the job?
So here's a secret that and I say this to a lot of emerging leaders when I'm mentoring. I said, don't worry about the title. Just be aligned with who you are. So for me, I don't feel like I have any other choice but to be this way. It would be so hard not to be this way. So I completely lean into the work that I do because I think it's part of my vocation. It's just who I am. And if you can just park titles and hierarchy and structure and all that long enough to do really, really good work just where you are, I think the rest comes. I think kind of those titles and accolades or whatever come. But it's really about doing the work and leaning in where you are and having the impact exactly where you are by being aligned with who you are.
Well, we really want to thank you, Kathy, for talking with us today. It's been a real pleasure.
Mine too. Thanks so much for inviting me.
Thank you for listening. You can hear more of our interview on our website, HIROC.com. Follow us on Twitter at HIROC Group or email us at communications@HIROC.com. Healthcare Changemakers is recorded by Ellen Gardner and Philip de Souza and produced by Podfly Productions for HIROC.com. Please rate us on iTunes.